Hey, and welcome to the Black Unconscious. We are your hosts. I am Dr. Justin Hopkins,
And I am Raquel Martin.
and this is episode 8 titled It Is Dope to Learn How to Cope.
Dope to learn how to cope.
That's
Yeah.
right. So, we're going to be talking about a number of different types of therapy, different therapeutic theories, different ways that psychologists conceptualize and understand the therapeutic process, getting into all those meaty details to further demystify the process of psychotherapy for you all.
Yeah, especially because I'll get patients that are like, oh my God, I can't stand therapy. And I'm like, well, what do you think therapy is? And they're like, I got to sit here and talk about my feelings all day. And I'm like, or you could just think of it as like, we have a goal, you achieve that goal, you don't have to see my face anymore. And I've really like, because I work with teens most of the time. So I'm like, half the time they're getting drug in by their hair and the parents are just like, they need to get fixed. And they're just like, I don't even want to be here, bro. I'm like, well, you know what? You fix your problem. You ain't got to see me no more, cuz it's cool.
Right. So different types of therapy have different goals and different styles. Some are very goal-oriented. Others are more open-ended and exploratory. Some are focused on symptom reduction. Others are focused on character change and more abstract or big picture lifestyle kind of goals. And so we want to get into all of those different things. But before we do that, before we get into our topic of the day, we want to do a really brief recap of last episode, episode 7, Black Boy Growth, Black Girl Pain. And so Raquel and I had a pretty intricate discussion about the development of Black men, how it shows itself in relationships, how, and particularly in heterosexual relationships with man and woman, the power dynamics, and also the emotional development of the genders, how they often play off one another. And essentially, we focused on the relationship of Jay-Z and Beyonce and how Jay-Z grew during their relationship as an adult man, but his growth also came at the expense of his wife.
Yeah, I don't even think we talked that much about the power dynamic, which I think is a whole nother, facet of it. But we will, because we have like a whole episode that we're going to do on sociocultural norms.
That's right.
And I'm sure it's going to end with me body slamming Justin into the wall. So stay tuned for physical aggression on air.
Well, so we disagreed. We disagreed, as we often do.
Because everyone is entitled to their wrong opinion. Everyone is entitled to be wrong. It is okay. That's cool.
Well, I think so. In a nutshell, I guess what I personally wanted to recap is to say that, one, if there's ever an example of a man enacting his emotional baggage or his own stunted emotional growth in a relationship.
I call it emotional constipation. I feel like a lot of men are emotionally constipated.
Right.
And y'all need some X-Lax because it's not going down over here.
But if there was ever an example of that, is it not Jay-Z cheating on Beyonce? I mean, he cheated on Beyonce.
Okay, like I as someone who's in the Beehive, yes, I think Beyonce is amazing and a goddess, but I don't know how she is in a relationship. So I don't think we should take it as like I get where you're coming from, but there are so many people that I'm sure they're amazing and they still forget to put the dishes in the dishwasher the wrong way, or they still be burning food, or they still never pick up the tab. I don't know, because I don't know. But from an outside looking in, yes, she is a goddess. So how dare she? How dare she?
Right. Well, and also she is his wife and the mother of their children, and obviously, yeah, you're right. Like most people don't know them personally, so we really don't know. But for just from the outside looking in, with the very little amount of information that we have, right? It's just. Here he is, like in a man in his middle age, and then stepping outside of his marriage, knowing everything that they've built together. It's clear to me that one, first of all, that that was wrong, but also secondly, there's something going on that man handled his.
Jesus, we should go to this week's episode. Because, like, I can't. Like, I'm not about to do this with you again. This is not happening.
Well,
like, because this is not the title of this week. This is not the title of this week.
We don't have to go through the details, but
yeah,
that's in a nutshell. That was my position.
In a nutshell,
is that there's
you having the last word.
You
enjoy that?
No. I want to hear what you're going to say too.
No, because it's not going to be 2 minutes, and we said we was going to. So this is supposed to be a brief recap.
This is brief.
This
is brief. Just saying, I think there's something with a lot of black men and their development of their emotions and masculinity that does make them handle their emotions in ways that are not healthy in relationships, and that includes infidelity.
Okay.
There's my piece.
I'm just gonna say my piece that some people just want to bone other people. I mean, yes, I understand what you're saying, but yeah.
So the topic of the week.
It's not always like your deep seated, emotion. Sometimes it's just that you're a butthead.
Yeah. I guess we're gonna agree to disagree on that.
Yeah.
Yeah.
It won't be the first time. I know it won't be the last time.
It certainly will not. So, episode 8, it's dope to learn how to cope. What is therapy? So, first, let's talk about the different types of therapy.
So, there's different kinds of therapy. There's family, there's couples, there's individual, there's group.
Different modes of therapy.
Therapy. You're right. Yeah.
Right. So, why don't we start with the one that most people know, individual?
Yeah, individual therapy. You have there are different orientations, but you're working individually. I think sometimes people bring family members in.
Yeah, well, and I think it's rare that people bring people in, but that does happen sometimes.
Yeah, and when it's happened for me, it has been incredibly rare. And the recommendation was always just like, cool. I do think you need a couples therapist because this is not.
Right, if someone were to bring their spouse in.
If someone were to bring their spouse in. And most of the time, it's the spouse. There even been instances of like teens bringing in like
their partner.
Yeah. Just like, I just think we need couples therapy. And I'd be like, oh my gosh, that is so enlightened. Also, not doing that. But like.
So you do individual and family therapy, and you work primarily with adolescents, teens, and children.
Yes. And then I also do, I haven't done groups in a year, but I have done groups as well.
Right.
And then the family therapy, it's just the way you think about it. But a lot of times I think there's a misconception that you have a problem family member and you bring them in to fix them. But no matter what, if one person in the family dynamic is having a problem, we're all having a problem. So the whole aspect of it is to see how it functions within the whole dynamic, how this contributes to changes within the parent, within the child, how your genetic variability or how your genetics comes to it. So we always do things called genograms, which show like the family history, and it's interesting to see like how parents, sometimes you forget how it was as a teen, so it's interesting to see how like your teen is having the same issues that your mom complained about with you. So the perspective is the most important part when there's more than one person involved in therapy, in my opinion.
Right. So family therapy, those genograms, they map like generations of family lineage, what those relationships are like, whether they are secure or whether they are fragmented or disengaged. And those kind of things can be really, really informative. And often the goal of family therapy, the focus is really on the relationships between family members and how they all interact with each other and the kind of dynamic that they instill within their family milieu. Like what is the emotional mood of the family as a whole? Is it a place where people can discuss how they feel openly and feel supported? Is it a place where people are more distant? Is it a place where people are too or very, very much very close and almost to where it's too close? Those boundaries are really diffuse. And so family therapy is where you work on certain boundaries and certain styles of relating with family members so that every person can operate in a more functional kind of way. Oftentimes with family therapy, you'll have someone who comes in, sometimes a child or the youngest of the group, who is the one who's holding all the symptoms the quote unquote black sheep or the problem child, they come in.
Yeah, and it's a result of like I'm holding on all the stuff that you guys like, because you're a result of your experiences, right? Like your
Right.
symptomology and stuff is a result of your experiences. So it's just like, yeah, they're holding in stuff because one, a lot of times people forget how much children witness, and then they just think it's them, but it's like they're literally a physical representation of every single thing that's going on in the house.
Right.
And you're just only seeing it through them.
And then, so family members may think that they are just the problem and they just need to get treatment, but they actually hold, or in some cases, it really is like while family think they're the black sheep, they're actually the one who's most woke.
Yeah, they're the ones who's just like, I'm not holding in my feelings,
right?
Screw y'all.
It's like,
Y'all
this
act
is
like
not
this-
right. All y'all are going
None
along
of
with
this is
it.
normal.
Right.
Screw y'all.
Everyone's going along with it, but they're not, and so they're the one who's depressed or anxious or struggling with containing their own feelings, because there's a dynamic within the family that is actually troubling to everyone, but they're the only one that is consciously expressing it.
I also think it's important to realize that, like, if you're going to family therapy or couples therapy, the clinician is not your referee. It is not going to be a time when you like, well, I said this, so don't you think I'm right? I'm not falling into that, because no matter what, you're the clinician for the entire dynamic, for the entire group. So I'm not going to, align specifically with anyone, because my patient is the family, or my patient is the couple,
right?
So, and not my patient, because Justin does couples, but so just understanding that, like, it's not so totally just to bring individual problems. And it's also important to understand that, like, yes, you may come in with your crisis of the day or crisis of the week, but most of the time the person is going to try to get to the root of the issue. So you may feel like, oh, I brought in this whole issue and I didn't even get to talk about it, but it's because, like, the overarching issue with you two arguing about, I don't know, it could be something like you don't understand why the parent doesn't listen to you with this, and you don't understand why they throw tantrums. And the underlying concern could be the child only has learned that the only way to get your attention is to throw a tantrum. Like, there's positive attention and there's negative attention. So the overarching issue to decrease the tantrums could be, let's set out some individual time where you actually get to spend time with your mom, or where you actually get to do things that you want to do. So, there are the problems I see are the symptom of the disease, and we're there to treat the disease. So I'm not there to treat, like, the crisis of the day or the crisis of the week. Like, I need to see what led to it.
Absolutely. So I want to move on to couples, but before I do, I wanted to add another 2 cents about individual, because I think the distinctions between individual, family, and couple are, we've kind of mentioned it, but if you're really new to psychotherapy or mental health talk, you could have missed it. And so for individual really is, as Raquel mentioned, it could be about, like, helping someone to achieve a goal. As I mentioned, it could be more open-ended, but it's about increasing one's understanding of oneself.
Yes,
right?
And how you relate to others, like how the self relates to others.
Right. So we don't give advice.
No.
Therapists do not give advice.
Because that's not my job, right? Because it's kind of just like, if I tell you what to do and you don't come across it, like, organically, you're less likely to retain it. It's kind of the way I think about it when I'm explaining that. I'm just like, okay, so if someone tries to tell you, okay, if you're going to create a document in Windows, just turn on your computer, hit the button, go on this, and do all that, and they're telling you verbally, you're not going to remember it. You need that muscle memory. And to me, going through the therapeutic process and coming to your own aha moment, that's the muscle memory. You're going to realize, like, the moment when you came across that realization, and you're also going to retain it when you have to apply it to other situations. Absolutely.
It's the difference between knowing in thought and knowing in visceral experience and emotion. And I often say, advice is cheap, it's easy to give, and it's often wrong, because I'm not you, right? It's not about me telling you what I would do in your situation. It's about you coming to a level of clarity and understanding in who you are to such a degree that you can make a decision, even when it's complicated, and even when there are pros and cons, even when there will be things that you'll gain and things that you're going to lose, but feel comfortable in the decision that you made, as comfortable as one can expect, because you're grounded in who you are, or you have a level of awareness in the things that you desire and need for yourself.
And so you don't come back and say, you told me to do that and it turned out wrong. And I'll be like, I did not tell you to do that. You decided, because it can be a cop out too. It'll be like, oh, well, this is what they told me to do. So if it goes wrong, oh, well, then it's not my fault. And no matter what, this is your process. This is your therapy. So I'm not sitting here telling you what to do. You're coming across that decision, and therefore you have more buy-in. And therefore, if it goes perfectly, which nothing goes perfectly, if it goes the way you want it to, that's great. If it doesn't, then we can talk about like what that means to you or how you feel about that. But you have autonomy over your choice. It's your life. No one is going to know the intricacies of it more than you. Like, patients come in and tell us about stuff, but like, I'm sure there are things that I forget to tell my psychologist about a situation all the time that, and may, so you're there, but you know better what's going to work out.
You will gain a better sense of what will work out for you as you go through the therapeutic process as well. And I think that's what's so effective about it, is that you learn yourself to a degree where you can decide on how to heal yourself. And during the process of our deep listening and understanding, and at times interpreting things that you're not able to see, providing some insight to things that the patient can't quite see because they're too close to the issue. All of those things combined allow one to come to a better place where they can both feel and think in ways that allow them to heal themselves. So couples therapy and individual therapy is obviously focused on the one person, but couples therapy, similar to family therapy, is about the relationship. It's not about one psychology. It's about how two psychologies interlock with each other. It's kind of like a Venn diagram where you have these two circles, and then there's this middle part that overlaps, and the middle part is really where it's really the understanding of each person understanding the other person's psychology, one partner understanding the other partner's gripes, complaints, where they come from within the relationship, what sort of things contributed to those issues beyond the relationship, that may have preceded that partnership, and learning how to empathize with your partner with things that may have previously been frustrating or annoying or complaint worthy. And so, similar to family therapy, you don't take sides in couples therapy. That's not what a therapist is there for, though everyone, of course, comes in with the hope that a therapist would validate their concerns. And if the therapist is good, there will be a validation of concerns. But what I often tell people with couples therapy is that, it's not so important that we have the 100% accurate truth, because couples will disagree on what happens in a fight. Couples always disagree on sometimes what brought them to therapy, but even more so within an argument, because an argument is a disagreement. They may have different versions of what happened, different versions of why they continued the argument in the fashion that they did. So it's not so much about you all agreeing on what happened. It's just about understanding the emotional makeup of the other person in that particular moment. And once you understand that, once you understand the why of the other person's behavior, it can become a little bit easier to empathize, but also to negotiate and compromise around those things. You have to get understanding first before you can compromise and negotiate. You can't negotiate about anything that you don't understand. So you have to understand the other person to a better degree. The other person has to understand their partner to a better degree. There has to be a softening of heart, a softening of emotions, and an openness to learn about the other person and to learn about oneself. And with that increased knowledge within the relationship, then you can better decide on things that you need to do to increase happiness and to work around the other person's feelings.
Yeah, which I think is incredibly difficult, because I've only practiced couples therapy a couple of times, and also, like, we of course study it, but one of the biggest things that I've seen that has been incredibly difficult within couples that I have seen, or that we've read about, or that we practiced about, or even within my own relationship, is, in the beginning at least, was to realize that it's not really like me against my partner, it's me and my partner against the problem. And so it's not like, oh, I'm mad at you. It's like, oh man, me and you are mad at this problem. So let's, like just kick this problem's ass so we can go get some food and like chill out. Like it's just, I think it's very hard to take your ego out of a relationship and to do that in front of someone else and to do that in front of like not only your partner but like a third party to help you guide through that process, because I think ego just doesn't really have a place in a relationship, because there's going to be times when you're gonna have to apologize just to be like, listen, it's not like I may disagree, but I made you feel a certain way, and I'm sorry I made you feel that way. So like that's something that needs to be apologized for. But it just seems incredibly
intent, and regardless of intent.
Yes, because to me intent doesn't matter, right? Like,
well, it matters. Like if you're intentionally trying to like hurt somebody, that does matter. But right to your point, right? Just because you don't intend to hurt somebody doesn't mean they weren't hurt.
Yeah, it doesn't mean you didn't hurt my feelings. So if I tell you that you hurt my feelings and then you just say you don't care, that's one thing. If I tell you hurt my feelings and you still stand by what you still feel like you were right in one sense, but you can also appreciate the fact that you hurt my feelings and you can apologize for it. Like that's growth. Like you don't have to be, to me, the effort is what really matters, or the fact that you really want to, try. It's really the effort, because you're not always going to be right. So it's really just like the fact that you're actually going to put in the energy or whatever to try to work for it.
I think one of the things that's so humbling about therapy with every different modality, individual, family, group, and couples, is that it's incredibly humbling, because you learn, if you're going deep enough into the process, I think what you learn is that no one really has a monopoly on the truth. No one is perfect. No one is 100% right.
No one has a monopoly on pain.
No one has a right.
Like seriously.
So you learn to both empathize with yourself and also empathize with other people, and you recognize that there's goodness in you. You can recognize there's good intent in you, but there's also the you that's flawed, and also the you that can cause pain in other people's lives, and even when it's not intended. And that's part of the tragedy of the human condition, that we're not perfect beings, and that despite our best efforts, there are times when we do things that are problematic, and we learn how to cope with that, accept those parts of ourselves, and learn how to change them at times, learn how to negotiate with other people so that we don't do those things, and also just figure out ways to be more accepting of ourselves and others. And I think couples therapy does that to a really large extent. Group therapy, I think we can we'll share a little bit about.
I love groups.
Yeah, you want to kick that off?
I love group therapy because one of the really good benefits is that a lot of times individuals think they're the only ones suffering through this problem. And while, your mental health is a fingerprint and you may be suffering a different way, I just think it's so helpful for others to see that you're like not alone in this issue, that you're not alone in this struggle. Like that, I think is like one of the things that really empowers people during group therapy. Mm-hmm. I also like the fact that in group therapy, I'm the clinician, but I also get to see like people who kind of just met or are getting to know each other, give each other support, right? Like they're just kind of be like, don't talk to yourself that way. Or like, I feel like, seeing them support others is helpful. Like they get to be the person that supports someone else, but they also get to be a person who receives help. So it kind of puts them in a different aspect. And it also shows like the way that they can have a healthy relationship. Like you have people that are dealing with these problems and they hear these problems from others, but they still see you as a good person, and they're still able to support you on what you're going through. Mm-hmm. Like I really like that. I like witnessing it. Like, so I like I like seeing group therapy, but I like to see the way that people uplift each other. And it's not someone that you may find in a different dynamic. It helps people like find their own voice in what they want to do, like in speaking up for their issues, because they feel more comfortable, right? Like you hear someone else's story, you feel more comfortable sharing your own. You're able to help you think about how you would have handled that situation. And it kind of it helps to give a visual representation of some kind of thinking traps or maladaptive patterns that you may have. Like if you hear someone talking about themselves the way you normally would talk to yourself, and you're normally like, hey, like it's okay, like you're safe here, like chill out, like that really helps, because a lot of times you do have to see it from someone else. So like I just love group therapy. Like it's great to see so many people like uplift each other and work towards a problem. And it also gives you like, you probably feel a little bit more comfortable. Like I know the first couple of sessions are probably like, awkward because you don't really know the people as much, but you do kind of have like a bit of a like a safety net, as it were, to just talk about your issues, because people are going through the same thing. And Yeah, I love group therapy. I think it's awesome to be able to facilitate it, but also to see the growth that happens with all of these individuals over time.
Yeah, a lot of people are resistant to doing group therapy because, well, if you've had this experience of individual therapy, there's the I think, well, there's the notion that you won't have as much airtime or that you won't be able to deal with your issue to the same degree as you would an individual. And, yeah, you share airtime with the other group members, but actually the contrary is true in terms of the speed of change. Change can actually happen relatively quicker in group therapy for a number of reasons. One, in individual therapy, there's just you and the therapist, right? And a lot of the things that come up, obviously, again, something that I often say is that no psychology develops in isolation of other people and their environment. And so those other people in the environment are on the outside. Now, different types of therapy allow you to address those outside problems in real-time feelings and emotions between you and the therapist, which I'll get into a little bit later. But it's really different when you're interacting with another layperson who's seeing something in you that you may not have seen. There like different things that can happen in group. For example, there have been times when I've co-facilitated a group. Sometimes that's another thing. There are often like more than one psychologist in the groups.
Oh yeah, always, because like most depending on the size of the group, it is really helpful, and plus it's really good as a clinician to have another clinician there because they see things that I didn't see, like whether it's when I'm in the room with a patient, it's important what you say, but it's also important what you don't say. Like silence speaks volumes, and I've just become, despite how much I talk all the time, I have become very comfortable with silence during sessions, which was like it was so hard to learn, like, oh, we don't have to fill the silence, but also what they said and how they said it, their facial expressions, and they may pick up on stuff different than we do. So I like that. And I also like the fact that it's kind of a sounding board, and you get to see honestly, you get to see some of the group members call other group members on their shit. Like, that's not what we'll do.
That's what I'm getting. Well, that's what I'm getting too. Well, I don't know. Well, the group kind of takes on its own psychology collectively as a group,
its
right?
own dynamic.
And so it starts off in this very like early phase where group members are just kind of get to knowing everyone, and
it's like
then
the first date moment.
Yeah, and you're being pleasant and doing some image managing,
paying for the food,
and then there's this way the group starts to do what's called norming, where it just kind of develops its own like normal habits and its own kind of ways of regulating behavior within the group, and then there's this phase of storming where people are actually talking more about the issues that they have with other group members and working them out. The dynamics that we have with people that are earlier in our life serve as blueprints for how we relate to other people. So if you have issues with people or just even a certain way of relating, it doesn't have to be like a really serious like damaged way of relating or a damaged relationship that you've had in your past, but we all just received the blueprint from how we relate to others by our family or our early loved ones, and we applied those to other people, and they work more or less to different degrees depending on that other person, because their psychology isn't going to be the same as the people that you grew up with or the people that are surrounding you when you were very, very young. So when those kind of things are happening and enacting, you get to really see like some of your own behaviors that may be contributing to certain problems in your life with relationships, problems in other people's life. For example, one of the examples that I wanted to give is that, I've both read about and experienced times when group members showed up late consecutively.
Oh my God, when this happens, I swear this happens in all group therapy.
Right, and oftentimes it may take a matter of a couple of sessions or a few sessions for anyone to say anything.
If it's the same person, and when
and
they
it's
say
the same
something,
person over and over, and they're the only one who's late. And now consciously, that person may feel like they really want to be here, they feel like they really need it, and they really want to get something out of this. But the group members are actually experiencing them as being non-committal, disinterested, aloof, distant, and consciously maybe that person is struggling with feelings of loneliness and feeling detached, yet they're also showing up late to their their group session. And so that's a place where group members can say, hey, we actually do want to connect with you, and this is just an example, but you're not showing up all the time. It makes us not want to connect with you as much. And then that's a moment for that person to kind of take in and recognize some of the things that they do, and perhaps some of the things that other people in the group have done that have made them less comfortable about being there that they haven't voiced, but also some of the things that they do to further perpetuate that kind of response in their daily life.
Yeah, because I think it's good when people realize how they're coming off to other people. So they just may not realize this is a problem with a lot of things. And then, as a clinician, I'm not going to say like, what the freak, or why are you always late? But other group members will do that. Like, I would just be more like, oh, is there anything that I can do? Is there anything that would that's making it difficult for you to come? But a group member will be like, what the freak, man? Like, you're late every single week. We're sitting here trying to talk about stuff. You come in the middle of it. Like, I mean, do you even want to be here? And they just be like, well, I do want to be here. Oh, okay. So why aren't you here? Like, it's just like a whole, and just watching it happen. And it's not like I'm going to cut it off, as long as I will make sure the person doesn't feel attacked, and you ask if they're feeling comfortable with it. But they really do just call you on it. And I'm just like, man, you don't really do that as a clinician, because I'm individually, because that's not what the relationship is more so about. I'm not here to just be like, oh, that's
I'm going to disagree with you on that.
To call them out on their stuff?
Well, it's not about so much calling out. I think it depends on your theoretical orientation.
You think so?
Well, because for me, to me, every single behavior has meaning. We just don't know it. We just don't know all of the meaning behind it.
Yes, I know. I know that's how you feel.
Right?
Mm-hmm. No, right. I know that's how you feel.
Okay. Okay.
I do think every single behavior has meaning.
Right.
I will say, like, unless I'm in a certain dynamic, especially if I'm working with with adults, I think you really do, given like the way, say it's like an anxious person, I would probably tread softly when it comes to like how I'm approaching them about certain aspect of that. Sure. However, in that same group, another person doesn't care, because they're not a clinician and they're not thinking about how they receive it. So the way I'm saying it is, given like the way that the person's personality and stuff is, I may approach addressing what may be seen as resistance differently versus someone who is not clinically trained and they don't care. And mind you, they probably get the same result. It's just like, it may take longer for me, but if you have someone trying to call you out on it. Right.
And that's how group therapy can accelerate the process of change and therapeutic growth.
Because they're not everyone in the room is trained, and they're just like, no, explain it to me.
They may shoot it straight, but then also you have your clinicians in the room to kind of help you unpack that and process that in a way that's meaningful.
Yeah, and make sure no one is feeling attacked, and even address, like, if the person who is saying like, oh, why are you always late? My first question after, while they're talking about it, is like, well, I understand that you're concerned about him being late, or that him or her being late. What is it? Is it because you feel slighted? Like, what are you pulling from right now that's making you so upset about this person being late? Because if the person is late, and is it because they're interrupting and you feel like the person they're interrupting isn't getting their time? Like, there's something beneath it, clearly. Right. So not only am I going to address the fact that person is late, yes, I know you were right, Justin. Now, I didn't say you were wrong. Just having flashbacks to the last episode when you were wrong. But I'm not saying that like I'm solely going to address the person that's going to late, but I'm also going to address the person who felt strongly enough about it to speak out about it, because they clearly had
something's going on
with that, and they feel a certain way.
So maybe this is a good place to transition to the two theoretical orientations that I think are most widely practiced. And so I'll start off.
Well, I don't know if they're most widely practiced. They're just like our own individual favorites right now. Because like,
maybe.
Yeah, because you're psychodynamic.
I know. So I am psychodynamic for the 11th time.
Or also like, because you're not your therapeutic orientation, so that's not who you are. So you are a psychodynamic therapist, even though I do call you psychodynamic all the time.
Right. Or psychoanalytic, the difference of which I won't get into, and for the sake of this conversation, I think it's I do actually think it's moot. And I think this is actually going to go back to some of the things that we were talking about in terms of whether you quote unquote like call something out. But so we'll get into that. But basically, like, the core idea of psychodynamic therapy, and like this, and psychodynamic therapy has been around since talk therapy existed. It was founded by Sigmund Freud, and there's a lot of controversy surrounding that guy. I'll just in a really brief nutshell say that there are things that he did that were really off the hinges, like just
Like
crazy.
what? Give a good example, like the biggest example everyone always talks about.
The biggest example was before we knew anything about opioids. He would prescribe opioids.
What opioid?
I think it was cocaine.
It was cocaine.
It was
Justin.
definitely cocaine. And he was actually he was a neurologist.
Yeah,
right?
he also a lot of it's interesting to me that he's always seen as a father of psychology, but
Right.
he did not identify from anything I saw as a psychologist. He's like
He's the father of talk therapy.
Talk therapy.
He's the father of talk therapy.
Yeah.
And the way that he became so known for his strides in both the scientific study of talk therapy is because not some of the things that he did that were problematic, but because he really did kind of break down how certain mental processes work and how things that happen to us that are beyond our awareness still play a role in our daily life.
Like the unconscious.
Like the unconscious.
Yeah.
And also, and I do want to say, like, most of the things that he said were actually quite progressive. For example, he's one of the first psychologists ever to talk about how both sexuality and gender are on a spectrum. But after his death, there were a group of scholars that came after him called the Neo-Freudians that kind of that were more extreme and more, I think, abrasive in some of their interpretations of his teachings.
Yeah, that's one of the few things I agree with him on, the whole sexuality being a spectrum thing.
Right, and gender as well.
Yeah, gender and spectrum. You know, because I specifically think it's a spectrum, and then gender's like a norm anyway. So
right, and his 3 essays on sexuality, I mean, there are way ahead of his time, and so they were very much misinterpreted at the time. So I think he's often known as being anti-LGBTQ, but if you read his original writings, you'll be pleasantly surprised that he's quite the opposite. So just to get into psychodynamic therapy, so the basic premise is that we have a conscious and an unconscious mind. I think you all know that. The conscious mind is a psychological material that we know. It's the organized, information-focused, logical, goal-oriented part of us. It's basically the part of us that you generally think of as being you. The unconscious mind is a really vast storage of memory and experiences spanning the course of your entire life. And in comparison to the conscious mind, the unconscious mind is much larger. And in addition to that, our unconscious mind doesn't code things or organize things in the same logical, reasonable fashion. Things are more encrypted and kind of unclear and complicated language, or it uses more symbolism and imagery. Freud is also known for having talked about how dreams are linked to our conscious and unconscious mind, and dreams use all sorts of symbolism and their own language and content to communicate certain messages and certain languages to us, even when we are asleep and for all intents and purposes unconscious. So many of our most impactful and developmental moments have meaning and influence that remain unconscious. And although we're unaware of its impact, it's the unconscious mind that is the primary source of all psychological activity.
Yeah, I think of it as an iceberg and then I always think about it like Titanic. I think I might have said this before. Like Titanic did not sink. So the above the iceberg, above the water is the conscious, and then below the water is the unconscious. And the Titanic did not sink because of what was above the water. It sunk because of what was below the water, like all the stuff that's driving, all the crap, and you're like destroying stuff. That's why it sunk. So that's why therapy is so important. And if you don't have that brought to the light, because it can really sink different aspects of your life, such as your relationships with friends, family, your work relationships, just everything. If you don't know like why you're reacting the way you are and what's driving it, because if you don't, you can't. What did you say? You can't heal what you don't reveal. That's what Jay-Z said. Yeah, but there was one thing you said on Let's Talk, bruh, but I can't remember the quote.
Well, you can't address what you don't acknowledge.
Yeah,
something to that extent. And Carl Jung, he's also an analyst. He says, that's Carl Jung. One quote that I really enjoy of his is, he says, "Until you make the unconscious conscious, it will direct your life, and you will call it fate." In other words, he's basically saying that our unconscious dictates a lot of what we do, but we don't know it, and so we just may attribute it to other things like destiny or things that kind of guide us beyond what we already know.
Yeah.
And really, it's As human beings, we actually, there's a lot of research to show this, that we are really, really confident in our own idea about like why we do what we do. We're really confident in telling ourselves like we understand why we did what we did. But what the research shows is that we're incredibly inaccurate.
We don't know what we're talking about.
No, right. Like we will say why we like a particular thing or enjoy a particular thing, and we'll say that we're really, really confident and sure of it, but we're actually not really accurate in those kind of convictions. So the whole premise of psychodynamic therapy is that the more we can understand ourselves beyond what we already know, and the more in touch we are with who we are, the more we can protect our self-worth, negotiate our self-interest, pursue a quality of life that is satisfying, and basically become more whole. There are things that we repress. There are things that we block out, painful experiences that we don't always fully acknowledge and heal from. And so psychodynamic therapy really, really holds up the value of honesty and truth, realizing that the honest truth is complex, that there's good, there's bad, there's beautiful, there's ugly, and we perform a lot of defense mechanisms to kind of dilute the reality of our complex truth by keeping those things out of our mind. But sometimes the energy we expand just to keep certain things out of our mind actually ends up being our downfall and ends up hurting us. So psychodynamic therapy is about exploring some of those defense mechanisms, working through them, and realizing that every human being has the potential to grow and change. And so the goal of psychodynamic therapy is lofty. It's ambitious. It's a long-term kind of therapy, and it's about character change. It's about real life personality change and growing in ways that are hard to know ahead of time, but that come out through the natural process of the therapy.
And it's going to be uncomfortable at times because growth is always, never comes without any kind of result of some aspect of discomfort. But acknowledging the reasons why you have done certain things, or acknowledging that like some of the good things that happen to you are because of you, and also some of the bad things that have happened to you are because of what you have done. Acknowledging that and realizing like, oh, it is a real my bad, like that was my fault, or something wasn't my fault. That's hard.
And I think sometimes too, right before we transition to the next one, I'll just say like, I think one thing that's really, I think is sad often for a lot of us is that there may be things that happen to us that are traumatic and that are really, really painful, and we deal with them the best way that we can, right? We employ whatever defense mechanism we can, or do whatever self-medicating or coping strategy we can to manage it. But there's this way in which there's something in us by like how we manage things. We can also invite like the kind of response that we don't want, that we hope to not get. For example, the person who comes into group late, who is feeling very lonely and is desperate for connection, experiences himself as very needy for personal belonging and acceptance, but also may not necessarily realize that just by coming 5 or 10 minutes late, there's an assumption that's being made of them that they're not interested in that, and so the people around them are less interested in meeting them. And so it almost kind of, and you can see how something like that can be a self-fulfilling prophecy if you're not aware that that's something that you're feeling.
Yeah.
So I think that's an example that we'll wrap up on for psychodynamic therapy.
Okay, so I am going to talk about cognitive behavioral therapy, and I think that is I think it's seen a lot as more of like the problem solving kind of therapy aspect of it. But it was created by Aaron T. Beck, and he was a psychiatrist. It was created in the 1960s at University of Pennsylvania, which is in Philadelphia, which is just the best place in the world. I'm totally not biased. And
I did my internship there. I do like Philly.
You are so lucky to have done your internship there. Philly's amazing.
I was right across the street from UPenn's CBT clinic, actually, in the Veterans Hospital.
Yeah. So cognitive behavioral therapy is called CBT, so I'm going to just call it CBT.
Yep.
But the reason why he came up with the therapy is because he was working with a lot of depressed patients, and in working with the depressed patients, he realized that they had like this whole stream of negative thoughts. And he called them automatic thoughts, and the automatic thoughts were negative ideas about themselves, the world, or the future. And he realized that by modifying these thoughts, he was actually able to make long-lasting change within the patients by facilitating the patients changing the thoughts themselves, because it's not like you can just like, you know, go in and say like change that thought. So it was and it sounds like, I think it sounds really simple now, but like it was groundbreaking at the time. Like I think it's really like, we always talk about like you know, mantra and positive thoughts and stuff like that. Like the majority of that came from CBT and other aspects too, but in therapy we always think about it that way. But the biggest thing is like the cognitive triangle. And we posted something like this on our page, but it's the connection between thoughts and feelings and behaviors, right? So the thought is how the situation is interpreted, of course. The emotion is the feeling that occurs as a result of the thought. And then an action or a behavior is the response to the emotion.
Right.
So the way I always think about it is that the reason why it's so powerful to change your thoughts, because that's the first part. You change your thoughts, you change your feelings, you change your behavior. And automatic thoughts are actually driven by what he calls like core beliefs. So it's the essence of like how we see ourselves, how we see other people, how we see the environment, like everything. I like to think of core beliefs as like our rose-colored glasses, right? Mm-hmm. So if you have a core belief that like I'm unworthy or I'm unlovable, your glasses are going to just facilitate out. What am I thinking of with these actions? Filter. It was another F word. I was like, what the freak? Yeah, so it's going to filter out. Sorry, I'm doing actions that don't make any sense. So it's going to filter out like all of the good stuff and focus on the bad stuff, because that's your thought. So if you're
also known as a schema.
Yeah, your schema. Mm-hmm. And, you know, I don't like using all the technical words, but okay. I know them though. I do know them, but like I just, you know, we're not at a conference presentation. So so the whole point, that wasn't a dig. Jesus.
I didn't say it was.
You just threw your hands up like, oh God. Yeah. So anyway, the core beliefs are like, think about it as your glasses. So like, okay, so you use an example, I'll use an example. So say you like meet a new person and you're thinking about like asking them for coffee. And this is also the reason why you can have two people in the same household and they have different responses to the same event, right? Because your core belief, which drives your automatic thoughts, which drives everything, it shows your scheme of how you see the event. Mm-hmm. So like say same situation, person asking someone to go to coffee. Like your core belief is I'm not worthy. So you meet a new person, you want to ask them for coffee. Your core belief is I'm not worthy. So you're just going to automatically think, why would they want to go to coffee with me? Like they're not going to like me or anything like that. So you don't ask them. So the core belief and then the thought and then the behavior, and then you don't ask them and you probably feel down about it because you're just like, oh man, I wonder why they wouldn't like me. That same situation, if you have a core belief that I am worthy, you're going to be like, oh, well, they seem like a nice person. I'm sure that they'll enjoy spending time with me. And then the behavior is that you ask them out for coffee, you get to hang out, and then you meet a new person, a new friend. So like it can be the same situation, but it's just keyed differently in your mind.
Mm-hmm. Right. Yeah, I think that's a really important piece, right? And one of the things that I'll just add really quickly is another way to like think about this is like for every single event that you have in your life, you have some sort of appraisal of it or some sort of perspective or opinion of it.
Yeah, nothing happens without you having some aspect that in you.
And that's the automatic thought. Yeah. Like that's not something that's voluntary by any means. Something happens, you have a feeling, you have a thought. Aaron Beck would say you have a thought first. When something happens, you have a thought about it, and that thought dictates your emotion, which then, of course, as Raquel said, dictates your behaviors.
Yeah, it changes how you're going to react to it. And there's a bunch of common core beliefs, like some of that, like I'm unlovable, I'm stupid, I'm ugly, and you know, and we're thinking about the negative ones, but you can also have like incredibly positive core beliefs as well, like the exact opposite. I am lovable, I am intelligent, I'm awesome or amazing or something like that. Mm-hmm. But it does dictate the way you see everything. And it's really hard to get to the nitty-gritty of what your core belief is by yourself. Like I think you really need like a trained professional to help you see that event, because a lot of times you are going through the same, like you're playing out the same tape, and it's because your core belief is this way, and you're really kind of like filtering out the positive, and it's like a confirmation bias.
Right, those glasses, right? right? It really is like that that filter, and so it can filter out certain things that you don't. Your core beliefs kind of filter out things that don't really align with them. And this also goes to the idea that you can't, like, no human being can have a complete monopoly on the truth, because no human being can understand everything, perceive everything, or take everything in.
Yeah.
And so depending on what your core beliefs are, you'll have certain thoughts, certain automatic thoughts about certain things that are more aligned with your core belief. The other thing is that the automatic thoughts, because they're automatic, you may not always know that you're having them. So, for example, what I often might say to someone is, and when I'm explaining this, is that, have you ever found yourself just like thinking about something so random? You're just like, how the heck did that come into my mind?
Yeah.
Right? Like, how did I just all of a sudden start thinking about that? Like, why am I? Or you find yourself in moments where you're kind of like thinking to yourself or talking to yourself, or a common one is when people go to lay down for bed, they start to have thoughts about all the things that they regret from years ago or earlier that day, or things like that. It just kind of comes up into your mind, and those thoughts lead to other feelings that could be a little bit more positive or a little bit more negative and affect how you feel about yourself. So these automatic thoughts, they just come and go. You're not in charge of them. So you don't have to necessarily take complete ownership of them. You don't get to choose every single thought that you have, because they just come into your mind and kind of go. You don't have to necessarily own every single one as complete fact, because you didn't necessarily choose to think that particular thing. So part of cognitive behavioral therapy is learning to become more flexible in your own thinking, and to question or give pause to some of those thoughts that you have that are either A, not the whole story and not completely truthful, or B, not helpful.
Yeah, and to do that, first you have to acknowledge them. And the way that I always find the easiest way to do that is to do a thought diary. Which one, they have an app called Thought Diary, but there's also, you can just write them down. And the way I normally do it is when you notice that your mood is starting to go down, or also on the flip side, I also like to have a positive aspect in session too, when your mood is going up. So you write down what happened, and then you write down like all the thoughts, like stream of thoughts when it's happening, and then you bring that in, and we're able to process it. And then we can also get to be able to show, like, it's a visual representation of like how those thoughts modified your mood, like the thoughts, and thoughts, mood, and then the behavior, and then what you did after that. And we can also find your pattern, because everyone has a pattern, and like the only way to work that out is to kind of track it, like, it's because it's everyone has some like maladaptive pattern, which is how you normally react to a situation, or how you react to a certain thought, or what your knee-jerk reaction is, and it gets you into some shit. So like you don't really know until you acknowledge that, until you play it out and you're talking with a clinician, and I'm like, oh, this sounds like what you did last time and that time, and like do you find that this is different? Like, I know it's a totally different situation, but you have the same outcome, like the same outcome of you staying home alone pissed because you didn't ask that person out to hang out, or the same outcome of you don't know why you are just I don't know, so angry with so and so, and it could be because you don't feel like you can have the power to express yourself to them. Like you have a bunch of situations, but I just feel like there's always patterns with how it happened. It's kind of like how I think about, like, when you were talking about relationships and relationship therapy. I think that couples have like the same, I don't know if it's like 3 or 4 fights, like it right. 3 or 4 fights,
and oftentimes, even when you, not to get too far off track, but if you map the progression of those fights, how they begin, there's usually a pretty regular beginning, there's a pretty regular middle where it peaks, and there's a pretty regular end where one person ends it somehow, either by walking away or just saying something that they wish they didn't say, and things like that. And I think the same can be applied to an individual psychology, that there's your core beliefs, but then there's similar kinds of automatic thoughts that you may have over and over and over. And again, if you're not mindful of them, what that means is that you're not completely aware of the things that you're telling yourself and the source of some of your emotions. According to what Beck would say, right? Like, you have to be aware of what you're thinking in order to understand why you feel the way that you do. And we're not always 100% aware of them. And it's not.
It's like the danger zone. It's why you can't really address it if you don't know what happened in the situation, or you may know it and it kind of just may be difficult or painful for you to acknowledge it,
Right.
And that's why it stays hidden in that sense. So
Right.
The cognitive triangle is basically like thoughts, feelings, and behaviors are connected.
Right. Right.
And they occur as the result of a situation. But the driving force behind all of that, the driving force behind like the majority of what you do or everything that you do is a core belief. And that is impacting everything. It impacts your, because if your core belief is something positive and core beliefs drive everything that you do, it drives the way that you see yourself, the environment, your future, everything, then it's going to be positive. But if you do have like an inherently negative core belief, and core beliefs are also often developed like when they're a result of your experiences. So your core beliefs are a result of your experiences, which is why the majority of the time individuals who have had so much trauma in their life, and it can be trauma such as living in a bad environment or having so many people leave you, whether it's like a parent, whether it's a spouse, it can that is going to be, those are going to be your glasses, those are going to be your tinted glasses, and that's how you're going to see everything. So that's why you do have to uproot it, and that's why it is so important. And it's one of the main reasons why I like working with children, because Frederick Douglass said it's easier to build strong children than repair broken men. And there's so much that happens when you are a child and you're an adolescent, you're a teen, and you're dealing with so much. And a lot of times it's kind of like it used to be, because I see a lot of kids now, but it used to be blown off. Like, oh, kids, I dealt with this, and it's not a big deal. And it is a big deal, because you're dealing, your voice becomes, I read a quote, like your voice, the parent, becomes the child's inside voice. Do you want that to be that you can achieve anything, or do you want it to be like you suck at life? Like, it's just, so the core beliefs, the things that are going to drive them in their relationships and the way they see the world, the result of their experiences, and the most salient experiences the majority of the time are when they're younger.
Yes.
So
right, our core beliefs are way more malleable when you're young.
Yes, it's like if you have a support system and stuff like that. That's why I just love working with like children. Like it, I like therapy is amazing, and I think that's why it was really fun to do this episode. But I also feel like just really blessed to be a clinician, because you have people sharing some like really intimate details about their life, and you really get the ability, because you have the proper training, to help them go forward with what they need to do.
Yeah, I think it really is a privilege. It really is a privilege to get to know people to such a degree that you do, and to be able to get close to people and understand them and help them to understand themselves better. I mean, I think it's a real privilege to be able to do that kind of work. And Raquel, you said you feel fortunate, and I definitely feel fortunate as well.
Yeah, I think it's an amazing job to have, and then just to be able to help so many people. And just because I don't think anyone lives in a bubble, and I'm working primarily with children, the amount of change that happens within the family dynamic when the child is just doing better, or the parent is just doing better, it's just it's like a generational thing, because it the same way that the trauma was passed down to us, the growth can be passed down as well to the next generation.
Passed up,
passed up. Because I was teaching
right.
my parents some things too. Like that's a maladaptive schema right there. You should work on that.
Well, even there are some family therapies, right, where you work with the person who has the healthiest boundaries, and by them changing, then the family system changes.
Yeah, because it is a system. Nothing, no matter what. Like a lot of times people come in and like, this child has a problem, and I'm like, cool. So like I'm gonna see all of you. I want like all of the caregivers in here. Like the more the merrier, because we need to work together. So yeah.
So, and just speaking of individual change, like as Raquel was saying, of like changing your thoughts, like one phrase that you guys can hold on to in terms of being able to like observe your thoughts is like catch it, check it, change it. You want to hold in on your thoughts, because thoughts are more malleable. You can't change feelings. You can't dictate feelings. Feelings are a visceral, biological, experience near kind of thing. And so feelings aren't right or wrong. And then events, you can't control events, but you can control you can to some degree change your thoughts. You're not in control of everything that you think, but you can. Once you're aware of what it is you're thinking, you can consider your thought as a hypothesis, question it, and then work on changing it. So catch the thought, check the thought by questioning it, and then see if there's some room to change it. Maybe you feel like the thought is 100% honest and truthful, but maybe it's not helpful. And so there's a different thing that you should tell yourself, because
Yeah.
that self-talk is really, really important.
Yeah, it's not all like rainbows and unicorns. We get that. But like, if it's not helpful, like, what is ruminating on this going to do? Like, and then if it is something that you can't change, okay, so what's going to be the outcome? So let's not focus on that. Let's focus on how I feel about it and what the outcome is going to be.
Right.
And then like, let's just focus on that. Because if I can't change the situation right now, a lot of times we're talking about like jobs and stuff like that. And it's like, well, I can't quit my job. Cool. So like, how do we modify your attitude so you don't have to deal with it? Like, so you don't have to be so upset. Because I totally understand that there are things that you cannot change, but if it's not a helpful thought, then let's modify the emotions and the behaviors. And then when you are workshopping, like questioning the thought, just you can ask yourself a bunch of questions, like, what am I worried that's going to happen, right? Like, how is this making me feel right now? Like, what evidence? You know, a lot of times I got this quote in my office that's like, I got 99 problems and 86 of them are things that have occurred as a result of overthinking and will probably never happen. Like, for real. So like, what's evidence that that the outcome I think is going to happen is going to happen, and what's the evidence that it's not going to happen?
Right.
And then if the worst case scenario is going to happen, how am I going to manage it?
Right.
You know, because you have survived all of your bad days. Like, for real, if you are listening to this, you have survived all of your bad days. So just figure out how you are going to,
I like that.
you know, deal with it. Because, you know, I get it. You can't like fix everything. I'm not going to say, you got a bad job? Well, quit that job. No, you got bills, and that's worse. So, you know, I get it. But, you know, if it's unhelpful, like Dr. Hopkins said, like, just figure out how you're going to manage it. Like, how do you deal with the worst case scenario?
Right. And then what other things might you think or tell yourself? Because those automatic thoughts is self-talk. It's you telling yourself certain things. So talk to yourself like somebody you love.
Yeah, be kind to yourself. How would you feel if you heard your mom, your dad, your best friend, your spouse, your mate saying the same exact thing? Would you be like, whoa, oh, that was harsh? Like, whoa, that escalated quickly. Because
Right.
like I like, if you could see all the things above people's head that they think about themselves, like, we all got some work to do, like, when it comes to just being kind to yourself.
Absolutely.
Yeah. So thank you guys.
That is it for us for this episode. We hope we did a good job of demystifying therapy for you all, the different modalities, and then 2 of the many therapeutic orientations that are out there that Raquel and I practice. So thanks for tuning in. Again, if you have more questions for us, things that you want us to elaborate on, or just things that you want us to discuss on our shows, please do visit our website, theblackunconscious.com. That's theblackunconscious.com. Click on that Ask Us icon in the menu and submit a question. We'll get it via email, and we will talk about your question during the episode, but leaving out your name so that it is anonymous.
Yes, and we're also going to have a mini episode where we answer the questions that we have gotten, because, guys, we've got questions. I'm so freaking excited, man.
Looking forward to answering those.
Yes, so we're going to answer those. Stay tuned, and thanks for tuning in. We've received a lot of support, and we really appreciate it. So
Take care.
Keep on subscribing.
Bye.